Are you curious about the powerful antibiotic Zyvox? In this ultimate guide, we will dive deep into understanding all aspects of this remarkable medication. Zyvox is a leading prescription antibiotic that is widely recognized for its effectiveness in treating various bacterial infections. With its active ingredient linezolid, Zyvox works by stopping the growth of bacteria, providing relief and healing to patients. Throughout this comprehensive guide, we will explore Zyvox's mechanism of action, its applications in different medical conditions, dosage guidelines, potential side effects, and important precautions. Whether you're a healthcare professional or a patient seeking information, this guide will equip you with the knowledge you need. Our goal is to present accurate and up-to-date information in an engaging and reader-friendly manner. By the end of this guide, you will have a solid understanding of Zyvox and its potential to combat bacterial infections effectively. So, let's embark on this journey of discovery and unravel the mysteries of Zyvox together. How does Zyvox work? Zyvox is a powerful antibiotic that belongs to the class of drugs known as oxazolidinones. Its active ingredient, linezolid, works by inhibiting the growth of bacteria. Unlike other antibiotics that target specific types of bacteria, Zyvox has a broad-spectrum activity, making it effective against a wide range of bacterial infections. Linezolid works by interfering with the production of proteins in bacteria. It specifically targets the bacterial ribosomes, which are essential for protein synthesis. By binding to the ribosomes, linezolid prevents the bacteria from producing proteins necessary for their growth and survival. This inhibition of protein synthesis ultimately leads to the death of the bacteria, allowing the body's immune system to effectively eliminate the infection. Zyvox's mechanism of action makes it highly effective against various types of gram-positive bacteria, including strains that are resistant to other antibiotics. This makes Zyvox a valuable tool in the fight against antibiotic-resistant infections, where other treatment options may have limited effectiveness. Uses of Zyvox. Zyvox is used in the treatment of various bacterial infections, both in hospitals and in outpatient settings. It is particularly effective against gram-positive bacteria, which are responsible for a wide range of infections. Some of the common conditions where Zyvox is prescribed include skin and soft tissue infections. Zyvox is often used to treat complicated skin and soft tissue infections caused by methicillin-resistant Staphylococcus aureus, MRSA, and other gram-positive bacteria. These infections can occur as a result of surgical wounds, diabetic foot ulcers, or other skin injuries. Pneumonia. Zyvox is also utilized in the treatment of community-acquired pneumonia and hospital-acquired pneumonia caused by susceptible gram-positive bacteria. It can be used as an alternative therapy when other antibiotics have failed or when the infecting bacteria are known to be resistant to other drugs. Bloodstream infections. Zyvox is effective against bloodstream infections caused by gram-positive bacteria, including those associated with central venous catheters or other medical devices. These infections, known as bacteremia, can be life-threatening if left untreated. Bone and joint infections. Zyvox can be used as part of the treatment regimen for bone and joint infections caused by susceptible gram-positive bacteria. These infections often require long-term antibiotic therapy and may require surgical intervention. Other infections. Zyvox may be prescribed for other bacterial infections, such as urinary tract infections, UTIs, including those caused by vancomycin-resistant Enterococcus faecium, VRE, and certain types of eye infections. It is important to note that Zyvox should only be used to treat bacterial infections and is not effective against viral or fungal infections. Benefits of Zyvox. Zyvox offers several benefits that make it a valuable asset in the treatment of bacterial infections. Here are some key advantages of using Zyvox. Effectiveness against drug-resistant bacteria. One of the major advantages of Zyvox is its activity against drug-resistant bacteria, including MRSA and VRE. These bacteria have developed resistance to many commonly used antibiotics, making infections caused by them difficult to treat. Zyvox's unique mechanism of action allows it to overcome resistance mechanisms and effectively eliminate these bacteria. Oral and intravenous options. Zyvox is available in both oral and intravenous formulations, providing flexibility in treatment options. The oral formulation is convenient for outpatient treatment, allowing patients to continue their therapy at home. The intravenous formulation is useful in severe infections or when patients cannot take medications orally. High tissue penetration. Zyvox has excellent tissue penetration, allowing it to reach concentrations in different body tissues and fluids, including the lungs, skin, and bone. This ensures that the medication can effectively target the site of infection and eradicate the bacteria. Well tolerated. Zyvox is generally well tolerated by most patients. Common side effects are usually mild and include headache, nausea, diarrhea, and rash. Severe side effects are rare but can include low platelet count and allergic reactions. Overall, Zyvox has a favorable safety profile compared to other antibiotics. Convenient dosage schedule. Zyvox is typically administered twice daily, making it easy to comply with the prescribed treatment regimen. This allows for consistent drug levels in the body, maximizing the effectiveness of the medication. The benefits of Zyvox make it an important tool in the fight against bacterial infections, particularly those caused by drug-resistant bacteria. Its broad-spectrum activity and effectiveness in various medical conditions have significantly contributed to its widespread use in clinical practice. Side effects of Zyvox. While Zyvox is generally well tolerated, like any medication, it can cause side effects. It is important to be aware of these potential side effects before starting Zyvox. Common side effects include gastrointestinal disturbances. Nausea, vomiting, diarrhea, and abdominal pain are some of the gastrointestinal side effects that may occur with Zyvox. These side effects are usually mild and resolve on their own. Taking Zyvox with food can help alleviate these symptoms. Headache. Some individuals may experience headaches while taking Zyvox. These headaches are typically mild to moderate in intensity and should subside as the body adjusts to the medication. If the headaches persist or worsen, it is advisable to consult a healthcare professional. Rash. Skin rashes can occur as a side effect of Zyvox. These rashes are usually mild and self-limiting, but in rare cases, they can be severe. If you develop a rash while taking Zyvox, it is important to notify your healthcare provider. Taste disturbances. Zyvox can sometimes cause changes in taste perception, leading to a metallic or bitter taste in the mouth. These taste disturbances are temporary and resolve once the medication is discontinued. Low platelet count. In rare cases, Zyvox can cause a decrease in platelet count, a condition known as thrombocytopenia. Symptoms of thrombocytopenia may include easy bruising or bleeding. Regular blood tests may be necessary to monitor platelet levels during Zyvox therapy. It is important to note that while these side effects are possible, many individuals taking Zyvox may not experience any adverse effects. If you have concerns about the potential side effects of Zyvox, it is recommended to discuss them with your healthcare provider, who can provide personalized guidance based on your medical history and individual risk factors. Dosage and administration of Zyvox. The dosage of Zyvox may vary depending on the specific infection being treated, the severity of the infection, the patient's age, and other individual factors. It is essential to follow the prescribed dosage instructions provided by your healthcare provider. The following are general guidelines for Zyvox dosing. Skin and soft tissue infections. For uncomplicated skin and soft tissue infections, Zyvox is typically prescribed at a dosage of 400 mg twice daily, either orally or intravenously. In more severe cases, the dosage may be increased to 600 mg twice daily. Pneumonia. Zyvox is usually administered at a dosage of 600 mg twice daily for the treatment of pneumonia. The duration of therapy may vary depending on the severity of the infection and the patient's response to treatment. Bloodstream infections. In the treatment of bloodstream infections, including catheter-related infections, Zyvox is often given at a dosage of 600 mg twice daily. The duration of therapy is typically determined by the healthcare provider based on the individual patient's response. Bone and joint infections. For bone and joint infections, Zyvox is typically prescribed at a dosage of 600 mg twice daily. The duration of therapy can range from several weeks to several months, depending on the severity and complexity of the infection. Renal impairment. In patients with renal impairment, dosage adjustments may be necessary to ensure safe and effective use of Zyvox. It is important to consult a healthcare provider for appropriate dosage recommendations in these cases. It is crucial to complete the full course of Zyvox therapy as prescribed, even if symptoms improve before the treatment duration is over. Abruptly stopping the medication can lead to incomplete eradication of the infection and increase the risk of bacterial resistance. If you have any questions or concerns about the dosage or administration of Zyvox, it is always best to consult your healthcare provider for personalized advice. Precautions and contraindications for Zyvox. While Zyvox is generally safe and well tolerated, there are certain precautions and contraindications that need to be considered. It is important to discuss these with your healthcare provider before starting Zyvox. Here are some important precautions and contraindications to be aware of. Hypersensitivity. Individuals with a known hypersensitivity or allergic reaction to linezolid or any other components of Zyvox should not take the medication. Allergic reactions to Zyvox can range from mild skin rashes to more severe reactions, such as difficulty breathing or swelling of the face, lips, or throat. If you experience any signs of an allergic reaction, seek immediate medical attention. Serotonin syndrome. Zyvox has the potential to interact with certain medications and cause a condition called serotonin syndrome. Serotonin syndrome is a potentially life-threatening condition characterized by symptoms such as agitation, confusion, rapid heartbeat, high blood pressure, dilated pupils, and muscle rigidity. It is important to inform your healthcare provider about all medications you are taking to prevent this interaction. Blood disorders. Zyvox can affect blood cell production, leading to low platelet count or anemia. Individuals with a history of blood disorders or bone marrow dysfunction should use Zyvox with caution. Regular blood tests may be necessary to monitor blood parameters during Zyvox therapy. Use during pregnancy and breastfeeding. The safety of Zyvox during pregnancy and breastfeeding has not been established. It is important to discuss the potential risks and benefits with your healthcare provider before using Zyvox in these situations. Drug interactions. Zyvox can interact with several medications, including certain antidepressants, migraine medications, and medications that increase serotonin levels. These interactions can lead to serotonin syndrome or other adverse effects. It is important to inform your healthcare provider about all medications, including over-the-counter drugs and herbal supplements, that you are taking to avoid potential interactions. These precautions and contraindications are not exhaustive, and it is crucial to consult your healthcare provider for a comprehensive assessment of your individual risk factors before initiating Zyvox therapy. Your healthcare provider will be able to evaluate your medical history, medications, and potential interactions to ensure the safe and effective use of Zyvox. Drug interactions with Zyvox. Zyvox has the potential to interact with several medications, which can affect their effectiveness or increase the risk of side effects. It is important to inform your healthcare provider about all medications you are taking, including prescription drugs, over-the-counter medications, and herbal supplements. Here are some of the notable drug interactions with Zyvox. Serotonergic medications. Zyvox can interact with medications that increase serotonin levels, such as selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and certain migraine medications. This interaction can lead to a potentially life-threatening condition called serotonin syndrome. It is essential to inform your healthcare provider about all serotonergic medications you are taking to prevent this interaction. Monoamine oxidase inhibitors, MAOIs. MAOIs, a class of antidepressant medications, should not be taken with Zyvox due to the risk of serotonin syndrome. There should be a minimum of 2 weeks between discontinuing MAOIs and starting Zyvox to avoid this interaction. Tricyclic antidepressants, TCAs. Zyvox can increase the levels of TCAs in the body, potentially leading to an increased risk of side effects. It is important to monitor for signs of TCA toxicity, such as rapid heartbeat, dry mouth, blurred vision, and confusion, when using Zyvox concurrently with TCAs. Blood thinners. Zyvox can interact with blood thinners, such as warfarin, and increase the risk of bleeding. Regular monitoring of blood clotting parameters is essential when using Zyvox with blood thinners. Medications metabolized by monoamine oxidase, MAO. Zyvox inhibits the activity of the enzyme monoamine oxidase, which can affect the metabolism of medications that are substrates of this enzyme. This can lead to increased levels of these medications in the body, potentially causing adverse effects. It is important to inform your healthcare provider about all medications you are taking, especially those metabolized by MAO, to prevent potential interactions. These are just a few examples of the potential drug interactions with Zyvox. It is crucial to consult your healthcare provider or pharmacist for a comprehensive review of your medications to ensure the safe and effective use of Zyvox. They can provide personalized advice based on your specific medication regimen and medical history. Thanks for watching.